Hi, this is Emily McCullough from the Fort Dodge Catholic Charities office. Today for Mental Health Monday, I wanted to do a brief overview of the very common struggle of ADHD. Attention Deficit Hyperactivity Disorder is what it stands for. And the attention deficit part refers to how a person may be lacking in their ability to focus or pay attention to things. The hyperactivity part means they may have excessive energy. And the word disorder simply means that they are experiencing symptoms to the point where it may be interfering with their functioning. There are three different kinds of ADHD. The predominantly inattentive type means that the person meets the criteria for the attention deficit portion of it. And sometimes we call that ADD. And that may be more common in adults because we don't have the hyperactivity portion as much. The predominantly hyperactive type means that the person meets the hyperactivity criteria. And then the combined type means that they meet both, of course. What I find fascinating and helpful to know about ADHD is that it is a neurodevelopmental disorder, meaning that there are differences in the brain of a person with ADHD when compared to a person without ADHD. Those differences include structural differences of the brain, brainwave pattern differences, differences in the rate at which the brain matures, and differences in the way that the different parts of the brain communicate with each other. Treatments and interventions for ADHD include therapy, medication, working with the school, and also managing environmental and lifestyle influences. So for therapy, cognitive behavioral approaches are likely to be used because they address thoughts and behaviors. Skill building approaches are also very likely to be used and are very helpful because when overcoming ADHD symptoms, we need to retrain our brains in a way, learn new skills. Involving the family can be a big part of ADHD treatment in therapy because we all need support for big changes, and especially children who most commonly struggle with this need the support and guidance of their parents. Therapy can be provided by a licensed mental health practitioner, just like all of the therapists at our Catholic Charities offices throughout the Sioux City Diocese. A psychologist may also provide treatment for ADHD, and they do something additional. A psychologist would have the training and ability to do testing, like paper, pencil, or computer-based testing to best determine the most accurate diagnosis, and they can also treat ADHD. Medication is from a medical doctor, and that can be your family doctor if they're comfortable prescribing medication. That can be your pediatrician because they would have that training. And that can also be a psychiatrist. A psychiatrist is a medical doctor who specializes in mental health. Another area of treatment and intervention for ADHD is working with the school and creating a team between the parents and the teachers and other school personnel, perhaps even, that can help develop accommodations for the child in the school and strategies for the parents to use at home and the teachers to use in the classroom to assist the child in overcoming ADHD symptoms. A final area that I wanted to touch on regarding treating and intervening in ADHD is managing the environmental and lifestyle influences. And these are all the practical little pieces of good health advice that we often hear from our health departments and such about a number of different things in our lives. For ADHD, it would be things like excessive screen time, because that has been shown to contribute to the development of ADHD. Chemical exposure, there have been links found there. Food choices and sleep habits. All of these basic things are things we can keep an eye on daily to reduce ADHD symptoms, prevent them from getting worse. So if you are concerned that your child or you may have ADHD, just know that there are many options available for assessment and treatment, and that it is a common problem. And calling your local Catholic Charities office is one of those options for assessment and treatment for ADHD. Have a great rest of your week.